disorder, inflammatory bowel disease usually causes significant weight loss. And then respiratory disorders, including pulmonary tuberculosis and COPD, usually has weight loss. And I have also included HIV to mention with the infective causes. Systemic disease such as heart disease, such as chronic heart failure, chronic obstructive pulmonary disease, even chronic liver disease can also cause unintentional weight loss. Psychological problem or psychiatric disorders such as depression, dementia may be associated with weight loss. Other causes include drugs, substance abuse, and social factors that prevent adequate access to food or social isolations. So how you will evaluate this patient? Obviously, you have to do a history and physical, and then investigate the patient. The first step of the history is obviously taking any history of coexisting medical disorder or past medical disorder. So take a past and present medical history, do an extensive physical exam, try to calculate or estimate the amount of weight loss, and obviously look for any evidence of specific cancer organ by organ. So you can start from chest. If the patient has hemoptysis, chest pain, shortness of breath, that means lung cancer. Then go to, if the patient is female, think about breast cancer, if there is any breast lump or not. Then go look for GI malignancies. So if there is a history of hematemesis, melena, abdominal pain, etc., suggest GI cancer. And if there is gastric pain, thrombophlebitis may indicate CA pancreas. If there is bleeding per rectum and severe anemia, may indicate colon cancer. Then go to the genitourinary system. If the patient has hematuria, probably indicate renal carcinoma. And in general examination, if the patient has lymphadenopathy, may indicate lymphoma or metastasis. And if the patient has bone pain and bone tenderness, this might indicate a bone metastasis. So those are the histories pertinent to different carcinomas, and obviously have to examine the systems carefully. Then go for the endocrinopathies, look for evidence of hyperthyroidism, such as patient who are intolerant to heat, and the patient has good appetite, patient has diarrhea, goiter, exophthalmos, pretibial myxedema, tachycardia, and hyperreflexia. So those would indicate hyperthyroidism. Look for evidence of type 1 diabetes, and usually patient will have polyuria, polyphagia, and polydipsia. For adrenal disorders, the patient usually will have weight loss along with hyperpigmentation and severe fatigue, and you will find postural hypotension and hyperpigmentation in different parts of the bodies. Then for GI disorders, usually IBD does not have that much of symptom, but the patient might have a lump or tenderness in the abdomen. Examine the lungs to find evidence of lung cancer, pulmonary tuberculosis, or COPD. Also examine the cardiovascular system to find evidence of cardiac failure, and take history, especially sexual history, to get a clue about HIV. If the patient has history of diabetes, hypertension, and the patient has history of oliguria, leg edema, that will indicate the patient has CKD. If the patient has history of smoking, vesicular breath sound with prolonged expiration, and has rhonchi on examination, that indicates COPD. If the patient has cough, shortness of breath, chest pain, leg edema, and bibasal crackles and gallop rhythm, that indicate the patient has heart failure. If the patient has fever, diarrhea, lymphadenopathy, sexual exposure, and unusual infections, opportunistic infections, that might indicate the patient has HIV. So those are the clinical evaluation. Then comes the laboratory evaluation. So the laboratory evaluation includes investigations such as CBC. And in CBC, we might find the patient has anemia or might have changes in the count. We also have to do the retics count, the retics and the LDH, to find evidence of lymphoma. We have to do the ESR and CRP. They might indicate an inflammatory disorder. Serum ferritin level should be done, and this will indicate an inflammatory disorder. Additional